Hey, it's Jess from Head to Toe Health. Just going to go through how to use kinesiology taping to tape through the knee. So this is a decompression technique, this one. So I've pre-cut a couple of pieces to go up through the main part of the knee. You want to make sure that you round through the corners. Rounding through the corners will help with reducing the chance of the tape pulling up from clothing, etc., running over it. So the first few centimetres, we want to tear the tape off, and this part is going to go directly onto the skin. So if you locate that kind of sharper piece on the shin bone that runs up, and then you get to the tibial tuberosity, which is a lumpy bit there at the top of that shin bone, we're going to lay the tape down on either side of that, and the stretchy part is going to start just at that tibial tuberosity. So you're going to fold the tape over just underneath that. So we'll do both sides, they run next to each other. The tape doesn't stick very well to itself, so we try and avoid those ends being one on top of the other. So from that position, and make sure your knee's in 90 degrees as well. So from that position, we're going to take the tape back a few centimetres left at the end and just fold the tape, the backing over. So from there, find the edge of the kneecap, the patella. So the edge for me is just there. So I'm going to run the tape just around the corner of that. So I'm going to come up, straight up, and then we're going to go around the edge of that kneecap. So it's right there. Edge of the tape runs across there. And going to loop back across the knee and then allow that tape. We're just going to take that end off, and that part of the tape, the end, is straight onto the skin. So the stretch only goes to the middle part of the tape. You'll get a better anchor that way and it'll stick better. So the other side, we're going to work similar with that one. So finding the inside of the kneecap there, running straight up the leg, and then we start to turn it around the kneecap and bring it into the other piece of tape. So there's two ways that you can run it from here. You can run it directly across the other side. If there is a problem with your medial cord activation, then I like to run the extra tape straight up through the leg. So from here, I would normally just run it straight across, then just let that tape come off and straight onto the skin at the top. So what I would do if there was an issue with activation medially is I would come onto the tape here, so that you've definitely got to the cross there, and then I would come across and up that medial quad. Okay, just to encourage the contraction of that quad on the medial side. So then you're gonna rub over the tape because heat activates the adhesive and makes it stick better. Now, if it's indicated, so if there's some issues with the kneecap pushing into that joint too much, there's pain underneath the kneecap, then we can open a new piece. So this is a shorter piece, and you're going to expose it a bit like a Band-Aid. Find the bottom of the kneecap, the lower pole there, so you can just find that soft spot underneath it, and we're going to run the top of the tape just at the lower part of that kneecap and get some stretch on the tape and then pull up through that area. So you can see you're getting a bit of wrinkling in the skin, and you're going to bring the tape down along the line of the thigh on both sides. So again, the ends go straight onto the skin. The middle part is the stretched area. So again, rub over that, activate the adhesive, get it sticking. And then when the knee straightens out, you should end up with some wrinkling. So what that's going to do is give more space underneath the kneecap, and so it'll relieve any pressure under there, and it also helps with your kneecap movement as well. So the other thing with the tape is it's better without hair, it's better without sweat, that it'll stick. So if you can shave down, make sure there's no moisturiser, best to do it after a shower, and then you can leave this tape on for 4 to 5 days, even more if it's comfortable. If you start to get any itching or any blistering, just take the tape off straight away.